Have you been told that you're a diabetic, a type 2 diabetic, or you have insulin resistance, or that you may have metabolic syndrome, and you don't know what all of this means, and you don't know what you have to do about it? Hi, I'm Dr. Chalam, founder of Holistic and Integrative Center of Novi, and this is the channel you would want to watch. Hey, before I go any further, just remember to go to YouTube, go to Holistic Icon, and hit the subscribe button so you get notified every time I post a new video, and you can continue to follow our channel. So you've hung out with me. Let me tell you a little about the diabetes, because when you have a dis-ease, the best way to overcome a dis-ease is learning how to understand this particular condition. So let's begin with the history, because the history of diabetes is so interesting. It's interesting to me, and let me see if I can make it interesting for you. So diabetes was recognized about 3,500 years ago, both in the Greek medical literature, in the Indian medical literature, and the Arabic medical literature. So in the Greek word diabetes means siphon, pass through. So they described it as a polyuric wasting syndrome. What is polyuria? Increased frequency of urination. In the Indian literature, it was really described as a young person peeing sweet urine and their flesh melting, losing their limbs, and having a short life. So it looks like they were all describing type 1 diabetes. In fact, let me tell you this very interesting anecdote about the diagnosis of diabetes. This was even when I was a child in the Indian villages. If somebody was having polyuria, increased frequency of urination, they would ask them to actually pee into a coconut shell. Like they would, the coconut would all be removed. People will just dry the coconut shell. They make a lot of things with coconut shell, a lot of artwork and crafts. But this coconut shell can also act as a container. And in the villages, the local doctor, somebody who knows a little about the body, is not the regular traditional MD, but their local doctor would just ask people to pee into this coconut shell, and they leave the coconut shell with the urine out in the open where there would be ants. If the ants crawled towards the coconut shell and started hovering over it, then that urine was sweet. That was the characteristic of diabetes mellitus. Mellitus is the sweetness of the urine. In the Arabic medical literature, they really recognize the complications of diabetes. So finally, they recognize this as diabetes, which is passing through. There is yet another condition also, which is polyuria, which means frequency of urination. And to differentiate that diabetes from this diabetes mellitus, that is called diabetes insipidus, which is tasteless. I wonder who really tasted all the urine, but these two conditions were recognized. But what was interesting was how they recognized type 1 and type 2, the type 2 being a disease of abundance and constantly revolving around diet. So there's a lot of evolution of the diet of diabetes. And very interestingly, they used the treatment of this, since there were no medications available, the treatment of this involved clay, earth, bituminous material, and silica, which makes me think that connection of earth or probiotics or the gut and the metabolic syndrome. So we get to delve a lot about the gut and metabolic syndrome in this channel, but it was very interesting to note these treatments existed way before we even understood how diabetes developed in an individual's body. So that was basically the history of diabetes. So it's been well recognized. There's something about diet. There's something about getting wasted away if your sugar passes through you, or the sugar passes through the kidneys. And what was very interesting is the treatment in those days was something to do not only with the diet, but to do with earth. So we'll delve a little more deeper into how the treatment of diabetes has evolved and where we are now in the last half of this video. So here's the interesting part about diabetes. So the condition, the symptoms were all recognized for centuries. However, why it developed which part of the body did it originate from took a long time. In fact, there have been several sequences of discovery of organs, glands, all of that had to take place in order to hone in that diabetes actually came from a specific gland. For a long time, pancreas was considered like the gallbladder of the stomach, just like the liver had its own gallbladder, but eventually they did realize it was a solid structure. And they found that when the pancreas was removed, and in those days they had dogs, not guinea pigs, as their experimental or investigative animal, and they would remove the pancreas and the dog would have high blood sugars and eventually die, much shorter lifespan. So they knew the pancreas had something to do with the blood sugars, or this condition called diabetes mellitus. And from 1619, I believe, or 1621, right up to 1921, there was a lot of disruption of the discovery of the treatment, the cause and the treatment of diabetes, due to World War I, due to, first of all, there was no Google those days, no YouTube. People did their own little investigations in France, in parts of Europe, in Canada. In fact, insulin was isolated in Canada. By the time it all came together, that there was the islet cells, which means an island of cells that produces this insulin, which is actually a protein. And this protein helped somehow get our sugars to be normal. And if you lacked insulin, you basically ate yourself. In fact, the body ate its own muscle, and these people would go into a coma and die. So in those days, it was almost tragic to develop type 1 diabetes, and all these children, because it was something that really occurred in childhood, the juvenile diabetes as it was called, would die, and there was no specific treatment. In fact, the various treatments, when you look at diabetes, is exactly the same what we do today, which is starvation. Now we call it intermittent fasting. But in those days, they used to literally starve these people because it gave them a little more time. In fact, their lifespan increased by months instead of days if they starved and did not eat. Then there was also the removal of carbohydrates, the low carb diet. Then somebody discovered that the low carb diet actually created less insulin sensitivity. So the fat content went all the way up to 70%, like we do in the ketogenic diet now, and then went all the way down to 15%. But interestingly, the content of protein in all of these diets did not change. So the diet was always toyed around with till the discovery of insulin. So Banting and Best is a name that's very well known when somebody is learning about diabetes or the history of diabetes and in the medical literature, because Banting was the principal investigator whose really the only goal was to extract whatever this was from the pancreas that impacted our blood glucose, and Best was his student. So Banting and Best actually rented this lab from a guy called McLeod, and they went through this process of trying to extract insulin. And I think the first boy who received insulin was 14 years old, and it was a dramatic change in his life. But unfortunately, the insulin that they extracted caused abscesses, because remember, they're grinding the pancreatic cells or extracting it from the dog's pancreas. So we know now from another animal, if it is not extracted correctly, we can actually develop antibodies and have a reaction. So eventually insulin was isolated, and Banting and McLeod, whose lab they used, got the Nobel Prize. McLeod had nothing to do with the discovery of insulin or isolation of insulin. So Banting felt it was unfair, and he split his Nobel Prize money with Best, his student. So that's a very interesting anecdotal story about the discovery of insulin. But today we know insulin has evolved, and in another video I'll go over the various preparations of insulin that are available and how they are useful. But what is important to know is they try to give insulin by mouth, and it would get digested, and which is why we came up with the injectable version of insulin. Now, accidentally, when treating typhoid, somebody discovered that the sulfur drug that was being used for the treatment of typhoid actually lowered people's blood sugars. And therein came the discovery of this group of drugs called sulfonamides. An example is your glipizide or glyburide. So that particular group of drugs was not accepted by investigators who worked on diabetes. This was way before the 1970s. It was only after the 1970s the sulfonamides were accepted as a treatment, oral treatment for type 2 diabetes. Interestingly came the other group of big drugs called biguanides, which was from the French lilac. And this is the common drug that we use now is metformin. Fenformin, which was also a derivative of this French lilac, actually caused a condition called lactic acidosis. Lactic acid is something that is produced from the breakdown of glucose, and fenformin was removed from the market, so was metformin, but metformin was reintroduced in 1994 in the United States. So now we have a couple of oral hypoglycemics, as well as we have insulin as a treatment for diabetes in the 1990s. What is very interesting to note is the bigger changes in the treatment of diabetes have revolved around diet. And a lot of this is because different investigators tried to help their patients with control of the blood sugar, because without good control of blood sugar, not only was their life shortened, the maternal, actually type 1 diabetics, women would never get pregnant, and if they did get pregnant, they died and the child died too. So there was a lot that needed to be done to help this group of patients. So right from low carb diets to high fat diets, and then back again to high carbohydrate diets, everything has been experimented with, and we still struggle with that. And each approach really needs to be individualized. So if you're confused about diet, I would say you're not the only one. The experts were confused about it too. So we'll delve a little more deeper into the physiology of the diet, the physiology of the gut, and what are the medications that are available, including supplements that will help you control your blood sugars. Now, if you like all of this information, click the like button, subscribe to our channel, and spread the word about how we are educating you on diabetes, especially those of you who have been recently diagnosed.
Hey, and before I leave, I want to ask you, what has been your understanding of diabetes, and what would you like to know?
Once again, I'm Dr. Chalam, founder of Holistic and Integrative Center of Novi, and the founder of this YouTube channel under Holistic Icon. See you. Take care. We'll see you next. Hey, before you go, a postscript. Check out our other videos. And as always, subscribe, and I will see you at the next video.